Brian and Andrea, the city health department takes in data to put together these health assessments every 3 years, and officials say that it's typically a mixed review. There are always things to improve, and there are also some things that they find they're good at. The new health assessment is filled with numbers mostly in line with the national averages and many positives. Overall, 72% of residents in the Sioux Falls metro area describe the state of health and wellness as good to excellent, and access to physical activity is high.
When we look at it holistically across some of the things we offer for quality of life and healthy living, it's not all about the health director here. Think about Parks and Rec at the city. We have one of the best park systems in the country. We have a bike trail. We have opportunities to exercise. Indoor recreation is something the city is investing in.
One concerning trend in the metro area is a sharp increase in sexually transmitted diseases. Chlamydia cases are above the U.S. average cases per 100,000, and syphilis cases have skyrocketed in the state as a whole, but especially in Minnehaha County.
The big concern with syphilis, too, is that the congenital syphilis, you're passing that on to baby. So pregnant mom to baby, not a good situation. That's one where I think we saw something get worse, but now some of the data is showing getting better.
Like national trends, obesity has been a growing issue in the state and in the metro area, rising above 35% of the state population. With substance use issues, drug overdose deaths are going down, but total overdoses have fluctuated. Methamphetamine is a less common of a cause of an overdose, but fentanyl has overtaken that spot. Another substance use issue is alcohol-related deaths.
I can tell you that the number of patients that are using alcohol, it's quite high, and whether they may not even screen out as having heavy use, it does impact a person's blood pressure. It does impact their liver function, even if they're just drinking it on the weekends.
A growing city comes with its challenges, but the city hopes to work alongside community partners to address these issues.
And over the next 3 years, we hope to move the needle so that we're back here 3 years from now, giving another community health assessment and ideally telling a story of some improvement in some key areas.
Now, the city's top health priorities after the report are healthy living, adolescent mental health, and access to care. You can find more about other key findings and the full report on this story at dakotanewsnow.com. Brian.
Parker, thank you.